Hello, we're Group 24, and this week we will be discussing electronic records in healthcare. The first article we will be talking about is called Leapfrog, CPOE is improving, but still misses fatal errors. Computerized physician order entry, or CPOE systems, are performing suboptimally and improving slowly. CPOE systems have been shown to fail to send alerts for 39% of potentially harmful drug orders in 2015. CPOE systems haven't improved in recent years, meaning that more people will receive medications in dosages that increase their risk of injury and death, and they missed 13% of potentially fatal medication errors. Additionally, the system sometimes doesn't add new treatments or guidelines and doesn't keep medication lists up to date to their CPOE. Leapfrog is a group of large employers and purchasers of healthcare services which has been stepping in, calling for hospitals to avidly monitor their CPOE systems. Hospitals, according to Leapfrog, should work with its health vendors and clinical leaders to improve medication reconciliation and avoid potential errors. Medication reconciliation, by the way, is creating a list of all the medications and related info, i.e. dosage and frequency, etc., that a patient is taking. Hospitals, according to Leapfrog, should have medication reconciliation processes and measures of accountability, seeing how 96% of US hospitals don't even meet Leapfrog standards for CPOE implementation.
The next article we'll be discussing is application of electronic health records in healthcare. There are both advantages and disadvantages to using EHRs. Advantages include varying degrees of access depending on the role of the individual. For example, a receptionist would be able to see different information than the physician. There's also increased efficiency because it's easier to find information on EHRs. There's reduced paper use, so it's more environmentally friendly, and files can be shared across different systems, which is more convenient. There's also disadvantages. So because the role of an individual determines how much access they have to the health records, it might tell an incomplete story about the patient. The article also points out that electronic health records may not be as useful in settings such as the ICU, and with so many electronic health record softwares, records may not always be aggregated, and a physician might need multiple logins to access the information. There's also issues with preservation and storage of records. So long-term storage can be difficult for electronic health records. Not only that, but different institutions and users may not be able to create, use, edit, and video and view records regardless of the software they use. Luckily, the Trusted Notary Archive, the TNA, can help by taking in data from different electronic health record systems and aggregating them for long-term storage. Thankfully, electronic health records can be stored longer than paper ones, and the exact period being determined by different institutions. Records must also comply with ethical and legal policies that are relevant. And finally, standardization is also crucial for universal understanding of these records.
Hi, I'm Sabrina, and I'll be talking about the components of EHR. The EHR system has to combine data from a lot of different systems in order to have the patient's information all in one place. So first, the administrative components include registration, administration, discharge, and transfer data, or RIDT, that is essential for patient identification and assessment. There's also a unique patient identifier called the Master Patient Index, or MPI, that links all procedures, evaluations, and diagnoses to the patient. MPIs can be used enterprise-wide, which means that they can be used across different institutions, and therefore data can be shared across all those institutions. Laboratory orders, results, and billing are included in the laboratory components, but it's difficult to integrate the laboratory components with EHR systems. The radiology components, such as results and image tracking, are used in combination with picture archiving communication systems, or PACS, to manage the images taken. Prescription information is included in the pharmacy components, but it's not automatically integrated with the EHR system. So, pharmacists have to re-enter all prescription orders into their own system, which has a potential for harmful mistakes. Next, I'll talk about the implementation of CPOE. So in order for the implementation to be successful, it must coincide with a workflow redesign and buy-in from all the stakeholders. When a new IT system is put in place, there must be education for all clinicians and staff. So workflow will be drastically changed. Education on the workflow and how to use the system is crucial for work to remain efficient. Medical devices can also be integrated so real-time alerts can be given when a patient's status is updated. This would greatly improve communication between healthcare providers and patients.
Privacy and security are major concerns for the EHR system. One reason is that with such a universal and national network, a lot of private information could be accessible by millions of healthcare providers. In addition, there is a lack of standards on how to handle clinical data. Therefore, there is also a lack of knowledge on how these standards would be applied to electronic record systems. However, keeping clinicians accountable is crucial to the advancement of EHR. Currently, there is an increased use of extensible markup language or XML and resource description framework or RDF. This creates a larger collection for structured data online and hence richer and more relevant results to online search queries. EHR systems are currently in the acquisition business phase, which means that larger companies are looking to acquire EHR software companies and improve on them. The future of EHR lies in the nationwide health information network, which would integrate clinical and transitional research information over large patient populations.
Hi, so now I'll be talking about my thoughts on the articles this week. And so first, despite both articles being pretty insightful, I thought that they were a little bit outdated. So the first one that we talked about in the video was published in 2016, which is pretty recent, but not that current. And then the second one was published in 2010, which was a while ago. So I think it's important to consider how EHR systems have changed since then. For example, the significance of things like privacy and UI UX has increased in the recent years. So it's probably pushed the healthcare industry to really improve on the EHR systems.
It's understandable that technology of electronic healthcare records isn't particularly easy to maintain or create with both reliability and usability, but there certainly seems to be a problem that needs to be solved. Keeping records is a difficult and important job. However, if 96% of hospitals aren't using their software up to standard, maybe there's an issue with usability that the market needs to respond to. Software companies creating and updating CPOE systems need to focus on making greater improvements because lives are on the line. Additionally, hospitals need to be accountable to train their staff to integrate themselves with the software to the point where they consistently use them despite any usability issues. Because lives are still on the line.
So I have some thoughts on the EHR, electronic healthcare records. I think it's a must-have for the smart IoT age, and although it's hard to build up because you have to combine data from different systems, but once it's built up and it's definitely cost efficient, it helps the environment by using less paper, and it stores longer than paper, and it's more manageable because everything's electronic. So in the long term, it's definitely a good thing to have. And I believe it will take the paper record place in the future.
So in recent years, the development towards an electronic and technology-based system in the health field has improved the ways of storing patient data and the efficiency in patient care today. Although there have been huge advancements, such as the EHR, there are still many areas of weakness. The example discussed in the CPOE article shows that technology can still be significantly flawed, and because of this, it cannot be completely depended on. As technology continues to run the experience of how a patient is cared and dealt for, medical care should still be personable between the physician and patient. As the technology continues to improve and integrate, physicians must also be able to integrate their personal care into the patient experience. Having a balance between the technology advancements and personal quality care will increase efficiency as well as accuracy.
Overall, I think that the benefits outweigh the disadvantages for using electronic health records, and it seems like all the disadvantages that were mentioned can be fixed throughout time. For example, I disagree with the fact that the records would not be useful in the intensive care unit. From personal experience, I know when I've been to the ER or had family members in the hospital, that even in settings which don't necessarily have like a follow-up, the electronic health records can be sent back to the primary care physicians, and I've had my labs and everything sent back to my primary care physician. It made everything a lot easier because I didn't have to repeat everything that happened during my visit, and they just already had everything on file. I think that there are some ethical issues with the storage of electronic health records, mostly with confidentiality and encryption, and I think those can be taken care of as long as the files and everything is properly encrypted.
Thanks for watching.